Just wondering, we always love Aplastic Anaemia Trust, and I know that you've been the founding member of it. Just tell us what stimulated you, or what thought process went into it for when you started this Aplastic Anaemia Trust.
Well, of course, I'm not a founder member of it. The trust was founded by people who were deeply involved with their family and patients who had aplastic anemia or the allied conditions. When we started transplants in '73, they had just found things called the Trexler tent, which was a big tent, a big plastic tent, in which the patient was supposed to be in a totally sterile environment and totally sterilized themselves. And this is provided by the leukemia unit, who were at that time ramping up the chemotherapy for, not transplants, chemotherapy. So these were and we were allowed to use those. Okay. And they were pretty horrendous for the patients. And so family of the patients who were involved here, it was successful in some occasions, but failures in others, got together and said, well, you ought to have better facilities. We will get together and support you, and found it. And so the founding members were really, of course, concerned families and patients. And we had an absolutely brilliant fundraiser who was also a thing called Philip Goodwin, who ran fundraising organizations like the triathlon, where we all went to France and cycled around and had a marvelous time. But they raised huge sums of money, and we were able to employ people specifically for the management and investigation of this very rare condition, aplastic anemia.
Thankfully, it still remains rare.
at a time when, of course, everybody was interested in the leukemias and the treatments and things. So it's the patients and the families of the founders. And
what do you think is one thing which we should be doing through the AAT, sort of a large vision down the line?
The need of patients with rare conditions is the communication between the families. That's the first thing that helps people a lot. The second thing is to make sure that the medical profession knows a lot about it. And because it is a rare condition. As you know, 1 or 2 patients per year get the condition. Now, of course, because people survive very well, the prevalence, the number of people who have aplastic anemia or have been exposed, know about families, is quite large. And they all need help and so on, which the AAT can provide. As advances come into the management of blood disorders, at AAT in particular, then I think there is a role for the AAT to fund specific periods of investigation or to help in those things.
Okay, and I've always, you touched upon it, and that I feel broadly now we're able to rescue 80 to 90% of patients with aplastic anemia, i.e. either cure them or treat them with ATG, cyclosporin, L-Trombopac, and keep them alive and have a good quality of life, which I think is significantly changed from what it was in the 60s, 70s and 80s.